find it in ourselves. So we had to find it in ourselves, something that would help us, keep going.
Yeah, definitely. And I think as much as people lean on other people and have a support system, I think a lot of the time you do have to go through those things by yourself. That's a really, really good point. Thank you. Dr. Romain, have you got anything to add?
I mean, I think our behaviour's changed in so many ways. I think, your first one about healthier habits or unhealthier habits, many of us, personally in the first lockdown, I was just stuck in front of a computer. I wasn't moving until I tried to develop kind of healthier routines to make sure I got a few steps in during the day. And it was interesting when I returned back to the hospital and was wearing a smartwatch that the steps I would do in the hospital, say I would always get my 10,000 steps. When I was at home, it was so, I was actively going for a really long walk to get those 10,000 steps. And you don't realize kind of just the exercise you do, without putting an effort in, shall we say, as someone who doesn't really love exercise. Although interestingly, I did see a poll saying something like 40% of people are actually doing more exercise in this time because they're kind of become more aware that they need to do it. And then just the other point, if I could, and I'm sure we'll touch on this later, but having to do everything via a computer, I never thought I would see a patient via a computer. I really didn't. For me, psychiatry is about that human interaction, being present in a room with someone who's telling you something really personal. And I never thought I would do that on a computer. And it's had some like really positive things that we could do that, but it's also been really, really hard. I'll let someone else speak.
Thank you. Some really good points there, and I can definitely kind of relate to kind of just being active in your day-to-day life, walking places. And now I think in terms of exercising more, maybe that's just because it's the only thing to do. I know for myself, I've been like, hey, the only thing to get me outside and to do something is actually to exercise, which is a good thing, but also shows kind of where we're at. So Dr. Huma, do you want to anything to add as well?
Yeah, I think we've in our sort of lifetimes, this is not something we've had to deal with, at least sort of not in Britain, and not anything on this sort of scale. And it is the social isolation and not really being able to see our friends and families and loved ones, especially during the difficult times. I think it's a burden we haven't really been prepared for. And navigating through that is a very, very difficult process. And especially with regards to students, but also junior doctors, I would say. I mean, just to sort of echo what Dr. Romain said, I never thought training would involve seeing people over a camera screen. And it's so incredibly hard. It probably gives you more sleepless nights. Have I done the risk assessment in the community properly? Because there are so many nuances in body language that you pick up during a mental state examination. I think 65 to 70% you get through just appearance and behavior. And that's one thing I think in terms of training, but also with the fact that a lot of things are going digital. Some of the discussions we've been having have been about the health inequalities that might arise from that. Certainly from a South Asian perspective, I know that a lot of the individuals from the generation above are not used to Zoom, Skypes, and some people have managed to learn and navigate, and others haven't. And that sort of sense of isolation, especially in a very community embedded culture, it's so incredibly difficult. And I think interestingly as well, I was doing my older adults post when everything was we were at the heart of everything, I suppose we still are. The language of depression and low mood is different amongst communities as well. And speaking to a few relatives, it's more sort of aches and pains, and understanding that as a younger core trainee as well has been a bit difficult. So it's probably brought to light a lot of inequalities as well.
Yeah, definitely. And I think we were quite involved as a charity at the beginning, but within the first lockdown, when the statistics came out that people from BAME backgrounds are more likely to die from the virus and more likely to be exposed from the virus. And social inequalities and health inequalities have definitely kind of come to the forefront. I think a lot of us were already aware that they were there, but COVID has exacerbated those. And I think also for children and for education, all of that is now online, but that favours people who are able to afford an internet connection and a computer and all of those different things. So yeah, some really good points there. So thank you. Dr. Smith, have you got anything to add?
Yeah, so sorry about that. I'm having problems with my computer because it's been on all morning and it decided it was suddenly going to try and start switching off. So just to say hello to everyone, and sorry that I'm late, but I've actually been doing clinic this morning. My name's Laddie Smith, and I am a consultant psychiatrist, and I am actually the clinical director for forensic services at South London and Wolsey NHS Foundation Trust, amongst other things. How has our behaviour had to change? Enormously, actually. We are social individuals, and what that means is that we are used to interacting with other people on a regular basis every day, and with our families, with people who aren't our families, getting on the tube and standing very close to people, too close to people actually. And what's happened is that we have literally had to distance ourselves, physically, mentally, metaphorically, we have had to distance ourselves from people. So one of the things that strikes me is, it's interesting that Rami spoke about how much you walk at work, and I walk loads at work. When I'm physically there, I've had to do a lot more working from home and seeing people via the internet, essentially. But so I've forced myself in that same way to go on these walks. I go for walks in the evening, and particularly at the beginning, I was going for these walks, and I'd go late at night because I would finish work very late, and there'd be other people out late at night, and we would have to skirt each other enormously, people going across the road from each other, things like that, in a way that you literally, I think, can't even walk past people now. So there are many things that we've had to do, but for me, it's very much about that physical distancing, but also the social. And I think, unfortunately, there's probably some emotional distancing that's happened for some people, but at the same time, because we've been apart, I was always struck, but I've been struck by the great feeling when you do get to talk to people over Zoom or Teams or whatever it is, family and friends, how much more open we've been with each other. So there's an emotional closeness that's arisen from that physical and social distance.
Yeah, definitely. Thank you. Yeah, some really good points. And I think you forget now how often you would see people and interact with people, even if it's in the shop, and you have that physical thoughts now that if you sit someone next to someone or near someone on a bus or on public transport, you feel as if you're physically invading their space. So there is a lot of distance there, and a lot of, I think, that plays into the loneliness that some people may have been experiencing, especially if they live alone and then they don't have that physical interaction. Because I know for me on placement, when I've spoken to elderly patients, they've said, the highlight of my day sometimes is going to the shop and having that interaction, or walking in the park and speaking to someone about their dog, because they do live alone, and then they're the group that's had to be kind of more socially isolated in this time. So definitely kind of has an effect. And just looking at the chat, people are saying they're more aware of their surroundings, and I think that does definitely make sense. We're now having to wear masks and be clean, and you're kind of more more aware of what's going on around you. And somebody else has said that their behaviour has had to change a lot. They're having to learn new skills, especially in things like IT, because that's now what we're all depending on. And then being aware of others and not making assumptions about anything, which I think is a really good point. I think during the lockdown and the pandemic in general, a lot of people have had a lot of things going on which they may not have wanted to share. So not making assumptions and still being empathetic to people is really important, and patience and showing kindness. And then somebody else has just agreed what I've said about the elderly. On GP placement, there's a lot of people grateful just to have a conversation with another human being, even if it's when they're at the GP and at a kind of health, in a healthcare setting. So great, thank you. And just kind of one of the sub points from that, there was something that people are talking about, such as lockdown fatigue, which is just being tired of being in lockdown, I suppose. So how can we, is there a way, and if there is, how can we try and reduce that and ensure that we're kind of able to maintain our mental health as well as possible? So I'll start off with Nana again, if that's okay.
So to reduce lockdown fatigue, I think it's very important to stick to a schedule, because I feel like with a schedule, it helps you, it just gives you a sense of security, stability, and balance. And it just, like it doesn't make you feel as if the days are too long and too short.
Mm-hmm. Yeah, that's been key for me. I think luckily I'm a key worker now, so I'm actually going into placement as normal, which allows me to have some schedule outside of that. But I think it's really important for those who don't to continue to work towards a schedule. But I think also forgiving yourself if you don't. I think I've had quite a few days where I've had the schedule looking at me and we're just looking at each other because I've just not been in the headspace to complete those tasks in that day. So I think also being kind of gracious to ourselves and allowing ourselves to, you know, be mindful of the situation that we're all in. So kind of getting that balance. Dr. Romain?
I was thinking that like a massive part of being in this lockdown in the UK anyway is this uncertainty. Like we never know when, like especially right now, like we've got this sort of plan, we don't really know what's going to happen. We saw things change over Christmas. And then having this uncertainty can make us feel anxious. We can't really plan things. So whichever way it's possible to try and be in the now as much as you can, I think is very helpful. Because if we're just constantly living in a kind of state of uncertainty, it can certainly kind of add to our stress levels. And I definitely agree with what you're saying about schedules, and I'm sure we'll come on to this later. I think part of having schedules or routines are things that everyone calls like basic, like your meals or your sleep. But I think your meals and your sleep are absolutely fundamental. I think so many people have had their sleep affected, they've been eating out of sync, or, you know, and I think really kind of, you know, some people set alarms to wake up in the morning to go to work. I'd say you need to set alarms to go to sleep while we're at home, and everything, you know, everything can just, you can end up on Zoom until 1 a.m. if you're not careful. So
yeah, definitely. I think people take those things, sleep and eat, for granted, but actually when those things start to lack, those can have like such a big effect on your well-being. So yeah, really good points there. Thank you. Dr. Huma, anything to add?
I think in addition to what Dr. Romain and Nana have said, the schedule part, especially the sleep, is so important. I went through a phase, and I sometimes still go through it, where days sort of bleed into each other, and there'll be work days as well. And slowly I've not really realised that I've just been absolutely just knackered. You know, and you're so prone to making mistakes, you start feeling groggy. So I think they're absolute paramount. And if you can have some sort of separation, especially if you're working from home, to your office space and have your office hours. And ironically enough, before this whole coronavirus, I always used to check my emails at odd hours, reply to them at odd hours. And it was a lot more doable. I can't do that anymore. And I don't want to do it anymore. So have that boundary of work or university and time that's sort of home time. But also I would say have a look at your sources of support. You know, just spend some time, think about, you know, what rejuvenates me, who's my support circle, what's, you know, if that's not a person or a thing, what thing is that? And once again, from personal experience, I hadn't thought about that until having to deal with the pandemic, and during some tough times, that, you know, it was all that support that got me through. So sometimes it's just good to check in with yourself. And I liked what you said about sort of forgiving yourself if you don't tick everything off. I think we're in a society where productivity and success is, it's very sort of I think it's quite rigid and not personal. So maybe think about, you know, what does productivity mean, and add in a little bit of self-care and downtime. And if you're not, you know, if you've not managed to learn 8 languages like your neighbor has, you know, during pandemic, forgive yourself. We all deal with things differently. And sometimes to pause and not do anything, you know, that can make, you know, a very good impact onto your mental health. So I would say probably compassion and kindness to yourself.
Yeah, definitely. That's a really good point. Someone's just said that they really agree. Time boundaries are really important at this time, especially because you're doing everything in one space. And that's absolutely true. Everything right now is in my bedroom. So I could very easily, apart from getting ready in the morning, I could very easily spend my entire day in my room. That's relaxing, working, everything. So making those boundaries is really important. Dr. Smith.
So it's interesting, the whole thing about lockdown fatigue, and I was thinking, yeah, as a, you know, I really value what everyone said, but there's something else as well, which is that where literally I keep thinking stuff, oh, when people say to me, how are you? So it's all right, but you know, it's tedious. I'm sick of it now, actually. I'm sure, you know, we all are. And quite right too. We should be tired of this. We are, as has been said, we are in this chronic state of low-level anxiety because of the unprecedented uncertainty. What we know about anxiety is that it is a physiological stressor. You know, it results in, you know, an outpouring of catecholamines, you know, readying us for fighting and flighting, whatever it is, except that this is chronic. Everyone's got it because we you know, because we're human beings. And what that means is that it's tiring. It is physically and mentally tiring and tiresome. And I would say to everybody, as has been said, actually, don't beat yourself up about the fact that you're sick of it. And because it's tedious. We've had enough of this now. We want things to move on. And so there are a number of things that, as been said, there's individual stuff, but nationally, one of the things that's going to help is when we're in a situation where we don't have to worry about it so much. So frankly, when you get your vaccine, because that's definitely going to help. We are going to have to get used to a different way of working. And so we need to start thinking about this. Actually, what are the opportunities here? Some of the opportunities are, for example, I can tell you right now that if this had been a face-to-face meeting, I wouldn't have been able to join you at all, you know, because I would have had my clinic and I would have had to run across town and I wouldn't have got to you till probably about 2 o'clock or 2:30. It would have finished. So there are advantages and opportunities we need to think about, but also, as has been said, for ourselves as individuals, having, you know, actually putting in place some of those techniques and strategies that we know help when we're in anxious states, actually. And that is having a good routine, having a good night's sleep, being able to have distractions. So that means being able to get out of your bedroom. It means having regular meal times, having time boundaries, all of those things that you'd usually do if you were in a state of anxiety. Get all the kind of basic things right, and that will at least help a little bit. But above all, I would say, absolutely, this is a tiresome situation, and we should all expect that we would be tired of it, because otherwise, if we're enjoying it, it means that maybe we're enjoying this a bit. I mean, some people secretly do quite like the lockdown. Actually, in my other half, it means great. It means I don't have to go out all the time. I don't have to socialise. I'm much more sociable than he is. But you know, now he's got an excuse. So there are some people who are kind of doing all right in lockdown, but most of us, I think, are just tired of it.
Yeah, definitely. Thank you, Dr. Him. Is there something that you wanted to?
I was just going to say, it's so interesting that you said that, Dr. Smith. I've got a few friends who've said, oh, the world's in lockdown, welcome to my usual state of affairs. And there have been people like, well, we were quite happily being introverts, and now there are people, you know, coming into our space and we don't like it. So it is quite interesting how some people have responded to it.
Yeah, definitely. I think it definitely depends on kind of how you are as a person. And I suppose if you're not that social, then lockdown is an excuse not to have to be social. But I think accepting that we are tired also helps us to be compassionate. I think sometimes people feel as if they need to be okay with the situation, but actually it's okay if you don't feel that way, or if you are tired, and that allows you to extend more compassion to yourself. So yeah, really, really great points, guys. I'm taking tips for myself. So yeah, thank you very much. So kind of to move on to the next subsection, obviously ACMM as a charity works to support future and current doctors and dentists, so kind of bringing that back to the people who are healthcare professionals. So during the lockdown, while a lot of people have been working from home a little bit more, and that does include a lot of healthcare professionals, a lot of people are still having to go to COVID wards, etc. So first question is just kind of, have there been additional costs for healthcare professionals? I think most people would argue yes, but want to open up to you guys. So Nana, what are your thoughts?
Yeah, I definitely think there's been additional costs for healthcare professionals. It kind of ties into the heroes and soldiers question, because when I think of heroes and soldiers, a common theme that occurs is sacrifice, someone who sacrificed something of their own for something bigger than themselves. And I think doctors are sacrificing their time, their energy, and they like they still continue to work, knowing the potential consequences of working at the hospital during COVID time, and especially for BAME healthcare professionals. During the pandemic, I watched a documentary called Is COVID Racist? And it stated that 2/3 of all NHS staff who died from COVID were part of the Black and minority ethnic groups. And that just made me wonder, how do healthcare professionals really feel about that?
Some really, really good points. I haven't still yet to watch that documentary because I have to balance the negative media, especially in regards to BAME people. That's just something that I personally do. But I think definitely what you said about sacrifice is a really, really good point. And I think it ties into that point of kind of being seen as heroes and kind of soldiers and stuff, which is helpful because I think people feel as though that's their way of showing support. Like, you're such a hero, what you're doing is so amazing, but then also there's the counter sides of that. So yeah, thank you. Dr. Romain?
I think I was going to echo exactly what you're saying, Nana. I think I found that horrific in the beginning when he saw Black and ethnic minority doctors, nurses dying, quite frankly, and because of COVID. And even when one of my close friends got COVID as an A&E doctor early on, I just thought, oh, how awful, because of your job that could happen. But people still do it. And in some ways we've been lucky because many of us haven't been as isolated as other people. Lots of my doctor friends actually feel so grateful that they can be useful in this time. Many of them who work in, we're in psychiatry, I'm doing a lot from home, but many are working on the wards or in A&E or in liaison. So in some ways they've been able to be really useful during this time. But I listened to something the other day that said a high proportion of doctors, nurses, and healthcare workers that have been working in ITU are showing symptoms of PTSD, even if they don't have the whole spectrum of that. So I think there's kind of longer consequences of it because lockdown's been so long. I remember my professor telling me at the beginning of lockdown, oh, like, you'll be back in the hospital by Easter, it'll be fine. And I got this job as a clinical research fellow, and then all our research was shut down and I was put back in the hospital. And we didn't think it would go on this long, I think. And there's also like talk of fatigue, kind of like from the healthcare professionals, and lots of nurses not wanting to return once COVID, once this is over, people want to leave the NHS, which is what I hope doesn't happen. But also when it is all over to some extent, like, what happens? Do we get to have a break? Lots of us haven't had holidays. People are, burnout's a real thing. They're saying that's the kind of second wave of COVID, is really this burnout within the workforce. Anyways, I don't want to be too gloomy, sorry.
I think I'm probably going to end up being a little bit more gloomy, Dr. Romain, so apologies for that. I do think that healthcare professionals, and I'd extend that to other key workers as well, it has been incredibly tough. And I know colleagues who have been working in ITU and who have been working directly with individuals who've had COVID, it's been tough. And if, as a health professional, you've cared for someone and you've tried to care for someone who has got COVID, and they're in ITU, it's incredibly, incredibly difficult. It's difficult to deal with maybe a couple of patients like that in a week or a month, but to have it consistently for a year, it's just absolutely draining. And I do understand, when there is a warm sentiment from the public who do call you heroes and they do clap for you at 8 o'clock, to some degree, I can understand that. But when it becomes politicized, and when it's all over the news and then it's used as sort of political ammunition with war rhetoric, heroes and soldiers, it's all war rhetoric. And no, we're not in a war. It's amazing somebody walked and raised so much money for us, but the NHS is actually not a charity that way. We pay taxes for that. We have an incredibly diverse workforce. There were patterns in who was getting affected more, as opposed to an act of applauding at 8 p.m. every Thursday being politicized. I would much rather my colleagues and we had PPE. I would much rather that we had that support and that recognition during those times. And once again, it's so hard for me to not be political in how I feel about things. But, you know, for example, how we're dealing with, you know, nursing stipends at, you know, in the middle of coronavirus and everything that's happening. I think there has to be a lot more sensitivity from institutions and from systems. And there has to be a lot more transparency and accountability, because that all adds, you know, other than coronavirus, which has been incredibly stressful, it's all these other things, you know, mental health incorporates your physical, but it incorporates the social aspects, you know, what your financial situation is like, what your social situation is like. And just going back to this rhetoric of heroes and soldiers, I feel so strongly about this, because even though, if I argue that there are good intentions behind this rhetoric, it strips away an aspect of humanity. If you're a superhero, we, you know, automatically think, you know, you might not be as affected by all the devastation and the death and the illness that we've seen. And, you know, just to sort of put my personal perspective there, I never understood what, despite working in psychiatry for so long, I don't think I fully understood what anxiety had meant until there were people that I knew who fell ill, and it is literally like a mountain sat on your chest. You can't breathe, you can't sleep, you can't rest. Your heart starts behaving erratically. You think, shit, do I need to be going to, quite passionate about this, do I need to be going to A&E? You know, and I had that for 2 months running. And I know that people, you know, we had in excess of 100,000 deaths. So for each of those deaths, there's a whole family that is going through that. And that is such a scary thought. It is such a scary thought. And once you add in the inequalities to that and all the other stresses that exist, it's almost as if, you know, we're just a bit of a ticking time bomb. And healthcare professionals, I feel a lot of NHS actually runs on goodwill. Nurses and doctors and our domestic staff, our secretaries, you know, who've had to adapt, who are there, you know, being redeployed, you know, just really there to serve people. You know, that I have there's an author of mine that I absolutely love his stuff. And when he was speaking about Pakistan in one of his books, he said, Pakistan produces people of extraordinary bravery, but no nation should require that of their citizens. I feel that of healthcare professionals. You know, we have that bravery, you know, people earnestly work away, but we shouldn't be asking for them to chip away so much personally. So there's a lot to be said, I think, just for institutional and systematic measures. And that's why I think the heroes and soldiers rhetoric is not great. But just so I'm not too doomy and gloomy, I do think we have an amazing, amazing workforce, and I couldn't have gotten through the last year without my workforce.
Thank you so much. Yeah, thank you so much. The points are really, really amazing. I think really touching as well, I know for myself, but I think, yeah, you made so many good points, but I completely agree. I think the soldiers and heroes rhetoric is hard, because also heroes and soldiers, there's that thing of, you know, you're going into war. It doesn't mean that your experiences are less valid, but that's sort of what you signed up for in that sense. Whereas for healthcare professionals, you sign up to give care. And like you said, there's things where you're clapping on a Thursday. And I know some of my friends and family were clapping, and I was just like, it's a nice gesture, and I understand the sentiment behind it. For a lot of people, they feel like that they can't give or support in ways, or not sure how to, so that is the way that they do. But I know for me, and speaking to kind of friends that I have who are doctors or working within the NHS, they appreciated the clap, but then they're also like, I'm struggling to pay my bills, or I'm working so much overtime. So it's hard to get that balance, I think. And someone in the chat has just said they agree so much with what you've just said, because healthcare professionals have had to give so much of themselves on top of kind of doing their job. Thank you. Dr. Smith.
So obviously I agree with what everyone's saying, particularly about the soldiers and the superheroes term. The fact is that the last year has been relentless, actually. And I think about, you know, I was a house officer in the days when we used to do, you know, there wasn't a working time directive, and we used to do, you know, like a stupid hours, 100 hours a week and things like that, and that was the standard. And I remember then having my kids and thinking, oh goodness me, you know, there's no respite at all. And you know, I work hard, and I've worked hard for years, and this year, particularly in the first few weeks, literally there was no stopping. It was every single day till very, very late at night. And it was relentless in terms of the amount of work. But then also there was the nature of the work. The nature of the work for everybody has been different, and it's different because we have been seeing, and this is across the board, including in psychiatry, we have been seeing people who have been sicker than they've ever been before. So we've, you know, initially in the first 3 weeks, nothing much was happening in psychiatry, and then everyone who'd been holding on just almost, you know, were breaking down in the streets. Then, in addition to that, we've had people who were developing COVID, and we've had some really sick people on our wards who we've had to manage, get them to the general hospital, but then we've had to really worry about them because they've been in ITU. And then in addition to that, there's all the people who have been working in, you know, in the medical and, you know, the medical services in ICU, who have said, usually we might see in ICU, we might be full, but there'd be maybe 1 or 2 people in the week that would die. And yet they're having 6 people die a night. So the nature of the work is it's much more than before. It's much worse than before. And it's been relentless. And then personally, frankly, especially at my age, unfortunately, I've had 3 of my good colleagues die this year. And when you mentioned it, I have to say, I was thinking, I'm glad you're not coming to me first, because I'm not sure I'm going to be able to talk about this. It's taking me a while. Just have to think, you know, I have to think about them. And this was, you know, this is right at the beginning, and it was so awful and scary. These were, you know, pretty young people. They're in their 50s. And it's been horrendous, frankly. It's been absolutely horrendous. And has it affected people's mental health? Of course, because if you have to work a lot, we know that, you know, overwork affects people's health. The nature of the work is that it has been, you know, as I said, it's been very severe, serious work. So the responsibilities that we've all had have been enormous. Even if you've been a manager in the NHS, having to develop policies and trying to make sure that those policies are going to keep people safe. So it's been horrendous in every single way. And the difficulty is that, certainly for me, the superhero moniker was kind of useful to begin with, because right at the beginning, we all had to, you know, club together and work together in the same way. And it was trying to get everyone to live and work in a different way, in a certain way. So it was useful from that. But I think then it became a cynical thing, because what it did is that it belied the fact that for years, people in the health service have been undervalued. And the way in which we show value for people often is the way that you pay them and the work conditions that they have. And we know that there's been chronic undervaluing of people who work in the NHS. By then saying, okay, you know, heroes and everything else, I was a bit cynical at first. By about 3rd week, it was like, okay, actually, yeah, this is quite useful. But actually, by week 6, it was like, yeah, how long is this going to carry on? Now, I think you need to acknowledge a bit more value. And it's very, very much a slap in the face for the nurses recently with this kind of 1% pay rise. And to say, well, the thing is that we haven't got much money. You sort of think, well, you've got money for other things. And the way in which people, there has to be a way of valuing people, and the superhero moniker masks people being formally valued. It belies the idea that somehow it's enough, and that if you work in the health service, as people will say, yeah, but you know, my you know, corporate lawyer mates used to say to me, you know, we've done exactly the same work, we all working stupid hours. This is particularly when we were younger, and they say, yeah, but you get the reward of making people better, and we don't get that. And I'm just going to tell you that, to be honest with you, if you'd asked me when I was 28, I'd have said I'd do my job for a chicken dinner, actually. But you know, now I've got a house, I've got mortgage, I've got kids, and you know what? Now when you get older, sort of thing, I'd like to be valued for the work that I do, and I'd like to be able to afford to have a comfortable life just like everybody else. And that's one of the ways that you show value for people, and that's not happening. And when you are having to work relentlessly for months and months and months and months with little holiday, because no one has been able to take their holiday properly, to the extent that you know, you're allowed to sell your holiday back to the trust, you know, you get money, or you can you know, you can carry over much more holiday than you could before, which was going to work, except for the fact that it's carried on longer than people were expecting. Then you haven't had the chance to have that downtime. And frankly, not being able to go outside, I mean, I live in London, so not being able to leave London means that you don't get the same, it's not the same as sitting by a pool in the south of France.
Absolutely.
And that's that.
No, thank you. And thank you for sharing such a personal experience for yourself. I'm glad you felt comfortable to do that with everybody you've got here today. But yeah, I think it's so important not to diminish it. I think, like you said, speaking to other people, people generally don't understand. Somebody said in the chat that people kind of neglect the idea that this time is actually extremely traumatic for people, but then also for healthcare professionals, because you've got your own kind of anxiety and things that you're going through, and then you have to be there for people, but be there for them in the sense that you're then trying to make them better, even if you kind of don't have that capacity, or you're struggling with that capacity within yourself. And like you said, just seeing so many people that die. There's a foundation doctor who I follow on Twitter, and she kind of documents part of her experiences as an F1, starting as an F1 during the pandemic. And she said there's been so many times where all her patients have died overnight, and she kind of has recurrent nightmares because of it. So it's really, really difficult to experience that level of trauma. Luckily, like Dr. Huma said, there is a kind of camaraderie, I think that's the word, of the NHS and of colleagues. But just kind of to come off that point, do you think there's anything that healthcare professionals or future healthcare professionals like myself can do to try and manage kind of what they're seeing and what they're going through? Any kind of tips? Because like you said, it has been relentless and really, really hard. And I think for people who are kind of further behind on their journey, kind of just starting out, it's for myself, and it's quite disheartening to think about kind of the profession that I'm going into and wanted to do for so long, but also the fact that a lot of people do feel undervalued. So any kind of ideas or tips for people to try and kind of mitigate that weight, that heaviness? Nana, if you've got any things that you may do personally.
I actually want to hear from the doctors, because I'm a first year student and I want to hear that too.
Okay, we're in the same boat. Perfect. So I'll pass over to Dr. Romain. Thank you.
I was actually say I keep going before Dr. Smith. Do you want to lead? Otherwise, I'm happy to. But
I don't mind actually. I suppose I am the oldest, so maybe it makes for this session anyway.
Yeah, I'm just going in order of my
sure. So just so people know, I suddenly realised that I've actually been a doctor now for and now when did I qualify? So I've actually been a doctor now for just over 28 years, which means that I think I might be a doctor. I've been a doctor for longer than some of you have been alive. So yeah. That's kind of like that's rather sobering for me, actually. I would say that over the years, and I did say earlier that I would have done my job for a chicken dinner, and that is true. And that's even when we would, and when, you know, we didn't have the working time directive, and we really were doing, if you'd asked any house officer when I started, you know, how many hours in the week, they'd immediately say 168, because you know, we were literally, we used to just do, I mean, stupid rotas that now that you wouldn't believe. And the thing, it was always rewarding, and this is why you don't have to get paid so much. It was always rewarding when people get better. Mm-hmm. And not just when people get better, but I always find it rewarding as well that you are in the privileged position, and this is something to try, especially have to kind of be mindful of, and you're always in the privileged position, no matter what branch of medicine you're in, except for maybe pathology, but you get to talk to people and you hear their stories. And if you and they will tell you things that they will never tell anybody else, whether that's a physical thing or it's an emotional thing. And that's a real privilege, actually. And so for me, I mean, that's something that always has helped to keep me going, in a sense. It does help as time goes on. You do earn more money, that's fact. And you know, when we talked about how money can be useful in helping you to feel valued, it helps to feel valued when you are valued by your colleagues and having good relationships with your colleagues. It's your work it is your family, it's your work family. And I would say to people that sometimes what happens is that you might work in a place for a long time and you get taken for granted, actually. And sometimes just it might be useful to move somewhere else first, or move somewhere else and then come back, because you come back and you'll be seen differently. And that's again another way of being valued, because we know that in our families we tend to pigeonhole people in certain ways. In terms of what's happening now, how to keep feeling valued, it is about maybe occasionally taking the time in your relentless day to spend a bit of time with someone who you know really values what you do. Because it does make a difference when someone tells you thank you. And we're so used to being the kind of superhero thing, we will forget the compliments. We're always dealing with the complaints. And I always try and say to people, yeah, you've told me about the complaints. What compliments have we had? Oh, I can't really. And then actually when you ask people, then they start to think about them. It's because people don't attend to the compliments, because that's often not in the culture. And so I would say attend to the compliments that you get, the little thank yous, attend to the compliments that you get, especially the written ones in emails and things like that, because people do value what you do, even if it's not always obvious and overt. And also I would say value those around you. If you're working with them, do say thank you and take the time. I now take the time to send an email, even if it's just to that person, but often to that person in their line manager, say thank you so much for what you did, because it really made a difference to me.
Yeah, thank you. I think that's definitely part of the culture. I've been in medical school for 3 years now, and I think there's not a lot of kind of accepting of gratitude. It's like, oh, this is my job, this is what I'm expected to do. And while that's true, it's also nice to be like, thank you, because I did make a difference in that situation. So yeah, really useful points there. Thank you. Dr. Romain, if you'd like to follow on.
Yeah, I think it's a really nice idea. Oh, I was saying that recently, one of our MDT meetings, so the meetings we have to have every week where we discuss patients and the service, and we always seem to end on some sort of problem with the service. And I was saying, can we end on good things, on compliments, on changes that we've made? I work in a team in SLAM called Optima. We are with bipolar patients. And we've actually been able to use this time for like real innovation, because we've had to do things online. I've been able to see, like, there's, you know, one patient I see every single week on video throughout the whole of the pandemic. And I'd like to think that I've supported this person in a really deep way. And that's like you're saying, complete privilege. But also we've had to be really innovative. Like, we've come up with a whole psychoeducation course online, making all the material like you're doing. You know, you're learning, kind of using these what have you just called it, a question to us online and things like that. We're developing completely new services. One thing I've loved, and my friends are such a geek, in the Maudsley we have these grand rounds where we've been really touching recently on some very important kind of topics. And before, you'd have to like run over to the Maudsley and you might not have time if your clinic overrun, but now we're getting like over 100 doctors coming and participating and listening to really important topics. So I'd say that there are some kind of good things in there as well. And then I think not to lose sight of yourself through all of this. So yes, seeing patients, having those appointments gets me up in the morning. It's the reason I jump up and I make a coffee, because I'm going to go and speak to people and I need to be kind of switched on. But certainly in our hospital, you know, people, they're trying to give us, you know, a free membership to mindfulness app or whatever it might be. But I did see this thing on the Maudsley website called the like stress MOT, and I thought it was very useful. And it was kind of likening yourself to a car, and that how if you had a car that has to go through its MOT, you wouldn't drive around a car that doesn't pass its MOT, but you need to kind of take stock of yourself, do an MOT. Are you sleeping well? Are you having breaks? Is your body working? Are you eating? What's your fuel? And seeing if you would pass your own sort of MOT, because you can't keep running on empty. So I think it's, whether it's once a month or preferably once a week, to just take stock, like, okay, what's happening? Maybe it's on a Sunday night. What's happening this week? Am I ready for it? Am I sleeping? Do I need to get help actually? Do I need to talk to a colleague, a manager, a GP? Because I think another problem with the superhero narrative, especially in psychiatry, you know, we suffer with mental health problems. Psychiatrists suffer with mental health problems. And I think sometimes it can be difficult for us to get the help we need, because we feel like we have to be indestructible.
Yeah, definitely. So yeah, I think especially kind of the reaching out for help is a huge thing. I think by nature of kind of the work we do with people go to when they need help. So it's hard to then recognize when you need that. But the MOT structure is great. I talk to myself sometimes and say, okay, how are things getting on? But kind of having a structure to go through everything. Mona Lisa, thank you, has just sent that in the group chat for people who are amazing. My team's amazing, who are able to do that in a structured way and kind of make that as part of the routine. But I also think because we're always so busy, we forget to take that time for ourselves, because it's always for the next thing. Oh, okay, I've got to be in this meeting, or I've got to do that. So it's really important to kind of take time and take that stock. So yeah, amazing points. Thank you. And then Dr. Huma as well.
Yeah, I don't think I'm probably going to have much more to add. That was quite comprehensive and amazing. But I think what Dr. Smith has said about feeling valued, I think is incredibly important. And we've touched a little bit about privilege and positionality, and the degrees that we have and the work that we are doing. We are still incredibly privileged. And I guess I'm at that level where I'm a trainee, so I'm sort of, I sometimes feel I can reach out a lot more easier to sort of both ends of the spectrum, from when it comes to very senior doctors to students. And I guess once again, my experience in this last year has been just such a massive learning curve, as I'm sure it has been for everyone else. I had to take 6 months off, and then I went back in and I had all the stresses of, oh my God, what's training going to be like? I'm not going to get, there are certain things that you have to take off and you have to show your competencies. I was worried whether some things would work or not. And it was the senior management who would call and say, Huma, how are you? And my response would be, well, I've not done my portfolio, I've not done this. No. How are you? And this is someone from the CEO of the hospital, my educational supervisor, who's also the program director, the director of medical education, who was my clinical supervisor, people who are so incredibly busy and who have the responsibility not only of their workloads and their MDTs, but also trainees. They took the time out to see how I was, and it was very personalized. And it was so humbling and so touching when you have senior leadership do that. They didn't have to, it's not in their job description, but they did. And that made me feel valued, and I didn't feel isolated in all of this weird labyrinth of life in COVID times. So I guess if we have that power and positionality to think about that, because sometimes that's all it takes, just to see how someone's doing. But in terms of sort of my own thing of how your team is not just your band sixes and your healthcare professionals and your secretary, it's also the domestic staff who you walk by every single day, you know, who are making sure that everything is cleaned down, the PPE team who come to place your PPE there, people who come to do their checks from infected, they're all your team. And if you can, and if you're there, try and say hello. And I always like to make a point of knowing them by name as well. I think it's so incredibly important. And things like that, it adds value, and you're working with people for 12 to 14 hours a day. You see more of them than people who are living, at the address you're registered to. And that's not going to change, COVID or no COVID. And I know we talk about hierarchies, and there's things to dismantle hierarchies within teams. And I completely understand that. And part of that process is knowing people by name, seeing how they are. Because people don't leave their identities at home when they come to work. When I come to work, it's not just Dr. Khan, CT2 trainee. I'm a woman, I'm a Muslim, I'm of South Asian heritage. I'm someone who was born and raised here, but, I can't be, 9 to 5 in a very Caucasian professional world and then come home to my South. We don't do that. So recognizing and accepting people as who they are. And I believe if we do that, we will have a self-sustaining community of kindness and compassion. And when all else fails, when we're being, sorry for this term, shafted for our wages, for being penalized almost for going part-time, for taking time off sick, it's going to be that family and that human factor that's going to give us hope. And I think the one thing from my work family that I've realized is the amount of hope. So always, in summary of this rant and ramble, recognize your power and your positionality, look above and look below, hold yourself accountable, and be transparent in whatever you're doing. And I think if you've got that motivating you, it's about the type of person you want to come through your job. You will learn the medicine, you will learn all of those things, but are you going to be the type of person that your healthcare practitioner is going to be able to come up to and say, you know what, I'm a bit stressed about this, non-work related? Are you going to be that person who gives them something warm to hold on to?
Yeah, Dr. Smith, go for it.
Can I just add that, Huma, thank you so much for saying that. Actually, it's so important. You just reminded me of something, which is this: everybody here, if you're particularly, if you're on this call, I'm pretty sure you're on your way to either in the profession already, or you're on the way to becoming a doctor. And it means, therefore, you may not feel it because of your background. I come from a very, very ordinary background indeed, actually. My school was put into special measures. If it doesn't matter how you feel in yourself, when I walk into a shop, they look at me and I'm a black female. They don't know anything about me. The security guard's still going to follow me around the shop, and we know what that means as an individual. Just once you, even though you may not feel it in and of yourself and your everyday person, you are in a position of power. And as Huma said, it's absolutely crucial never to forget that. And that means that when you say hello to the domestic on the ward or the healthcare assistant, and that person's name and something about them, it means so much, because people will be looking to you for how they should behave towards others. So and that's a kind of lesson. That's not a COVID lesson. That's a lesson for life. And what you'll find is that when there's a big corridor that goes through the Maudsley, and you'll walk down the corridor and you'll see people that, you don't necessarily have to sit and chat with them for 5 minutes, but acknowledgement, if you see someone you recognize, acknowledgement, say hello. It doesn't matter who you're with, if you're the chief executive, whatever, it makes a difference. There are some people who just do not do that. And there are some people who will say to you, why are you even bothering to stop and say hello? That's not the attitude. You will have a much, much, much better time in your work life, and you will make, and very importantly, you'll make a difference to other people's work lives, because no matter how you feel and how you might be being bullied at work, whatever goes on, you're still going to be in a position of power that is never to be forgotten about, actually.
Yeah. Definitely. Thank you so much. It actually reminds me of something that my mum's a primary school teacher, and I remember as a kid kind of going in after school to get taken home or whatever, and she'd always make a point of the same thing. So knowing the cleaners that come to clean the classroom after she leaves by name and having a conversation with them. And I remember her telling me one time that the first time she did it, they looked at her like, why are you talking to me, sort of thing, and didn't think that she was directing speech towards them. So I think it's just showing that value to everybody, especially in a setting where we do sometimes feel undervalued. We are, like Dr. Smith has said, that we are in positions of power, and in that kind of hierarchical structure, we are at the top. So it's important to extend that value to everybody who may not be as treated as well as we are. Amazing discussion, guys. Just in the interest of time, I'm going to kind of skip over to the Q&A session. We've got a couple of questions in the chat that people have wanted to put forward, and then we'll go to one kind of closing remark from each of you before we go on to our amazing survey. So I'm just saying this because I personally don't like doing surveys, but they are very needed. So the first question from Rosina is, has racism increased in the workforce during the pandemic? And thank you, Dr. Hema, I've seen you've kind of shared a response already. But yeah, just to open that to the panel. So Nana, if you've got any thoughts?
I think definitely towards maybe the Asian communities. I'm not 100% sure because I don't work in the workforce, but from everything that we've been hearing, the news and everything, yeah, I definitely think Asian communities, there's been a rise in racism.
Yeah, definitely. You've seen quite recently, I suppose, on social media, that push to address Asian hate crime as a result of coronavirus kind of coming from China, as people will perceive it. So yeah, thank you. Yeah, Dr. Romain.
I'm not so much sure in the workforce, but I guess we've got to remember that kind of the Black Lives Matter movement and everything that happened with George Floyd was during the pandemic, which, you know, was incredible. And well, not incredible, but I think you know what I mean. And for that reason, I think really important conversations have had during this time, actually, especially in mental health, where there are lots of inequalities. And I'm sure obviously Dr. Smith can talk about this a lot more from all the amazing work that you do. But I think hopefully there have been some positive outcomes, certainly within the college, trying to work around inequalities within the workforce, but towards our patients particularly, like why is it that we do have, you know, more Black men being sectioned and or non-UK trained medical students failing our exams, that sort of thing. I think that they're really, really important points.
Thank you. Dr. Hema, I know you said a little bit in the chat already, but if anything else to add?
I'd agree with Nana. I think the response initially to people of either Chinese ancestry or expats or economic migrants, it was quite shocking. Overall, I think things relating to race, we've had a lot of difficult discussions. And when the protests were happening, it almost seemed as if things was divided. And there were some very harsh opinions coming across, like, oh, you know, we're in a COVID world, why is this happening? You know, people through their protests are propagating X, Y, and Z. And it just, with the issue of race and with the issue of the difficulties we were talking about, if people during a COVID world are coming to the streets to protest about something, you know, that is saying a lot to me. And I personally had some difficult conversations. So I do think, you know, I'd echo what Dr. Romain said, maybe not in the workforce as such, but generally in society, I've just found the rifts to be widened. They existed, but through COVID, I sort of felt things weren't really great. They were a bit more in my face.
Yeah, I think it kind of goes back to what we were saying earlier on about kind of COVID exacerbating things that we already knew existed and bringing things to the forefront. Definitely. Dr. Smith, anything to add?
It's an interesting point, actually. It's an interesting question. Is there more racism? I think, you know, there are different types of racism. The institution, the structural racism was there always, you know, it's been there for years and years and years. That hasn't changed, number one. The internalized, so the overt racism, that's actually been, it's been a lot less over the years than it was when I was younger. And that's, you know, people calling you names in the street and the stuff that you'd hear on telly and everything else. And it was very normalized, actually, for there to be overtly racist tropes riven throughout television programs. It was okay, and it's not okay now. And despite everything that's happened in the last year, it's still not okay. And it's interesting that Huma, you described the kind of, it feels like there are more divisions. And I think what that's about is the shock and surprise to find that there are still people with these really quite strong attitudes, but they never went away. They were always there. So for me, it feels like, I'm not sure that there's more racism. I think it's just that it was always there. It's just that, you know, people perhaps weren't quite so aware of it because people knew that they weren't allowed to say anything, whereas they just felt like, I'm allowed to say it now. And when it comes to the internalized racism, I think that there's and this is something that's, I know, very hard and sometimes uncomfortable for people actually, but that's the racism that people have about themselves and others of their own ethnicity, and also that kind of hierarchy that people do about other ethnicities, people from other, and I think that perhaps that people have started to recognize their own unconscious bias more than they maybe did before, and maybe talk about it more. For me, I think, if you talk about something, then you're much more likely to know what you've got to deal with. So as negative as some of the vituperative discussion has been in the last year, to me, I think, well, at least we know what we're dealing with now, and at least we know what argument it can help us to develop the arguments and to find strategies to make a difference. So I know it feels like it's like, this is horrific, but it does also, for me, I think, good, right, now we know what we've got to do to make change.
Yeah, definitely. Sorry, Nana, did you want to make a point, and then I'll go to Dr. Huma?
Yeah, I just wanted to say that I agree with Dr. Smith. I feel like the pandemic has shed a lot of light on systemic racism. It was actually found that 46% of Black households in the UK were in poverty, compared to just one in 5 white families. And that just means that these families are disproportionately exposed to job losses and pay cuts. And I think it's just really important for people to know that they shouldn't really anchor their identities and their work and income, because I feel like a lot of people do that. And it's like, in this time, it's very important to emphasize to your loved ones that they're cherished and valued, and their worth is not in their income.
Definitely, really good point. I had to kind of skip over that section just in the interest of time, but we are kind of going to touch on the economic poverty and the implications financially on people. Dr. Huma.
I think it's just such an important point, to hone in on what Dr. Smith said about racism has always been there, and it's what we're dealing with. But I also think I don't know whether I'm more aware of it now, but it seems like we're in a world where it's more acceptable for people to be racist almost, or to hit on certain aspects of one's, intersectional aspects, whether it's, gender, whether it's a person's faith. If we look at the current political climate, not only of the UK, but of the world, there are things that people are saying on very political and social platforms that, I'd be quite horrified with, whether it's racism, whether it's sexism, whether it's homophobia. It just seems a bit more acceptable. But if we have a look at the UK in itself as well, in terms of the systemic and in terms of the institutional racism, I think, there's a lot of work to be done there, but also in terms of education as well. Having been born and raised in England, I've been told, your English accent is amazing. Where do you come from? Leeds, thank you very much. It's like an old joke now. But where is that history? Where is that? Because I'm raised in a world where I'm told, well, actually, you're not white or you're not Caucasian. What are you? And I've been at a loss for answers. And what that does is it sends you off on this existential crisis of identity. And I feel that we need to look at the education system as well. And a lot of this moral grounding, it starts off in our homes, but it should also be in our playgrounds and in our universities. And once again, I'll always come back to the point of transparency and accountability, which I feel that our academic and our institutional spaces need to have. It's not merely having, a half an hour e-module on an equality and diversity course at work. I am passionately abhor and hate those, and it's showing from my face. I just think racism and inequalities, it's so in some places we're having these conversations in light of COVID, and you and I will know, and from the work that ACMM is doing, it sort of stretches a lot further back. Even if we look at medicine, and if we look at GMC, and if we look at complaints, and if we look at the processes that take place, and even if we look at the outcomes of these disciplinaries, there's a massive racial and ethnic gap in terms of the outcomes. And I just feel that I don't know when and how there's going to be a sort of a collective look at things, but I think, at least in my lifetime, these sort of processes I'd love to be had a look at, because race does play such a major part in there, whether we accept it or not. And people talked about the disparities in exams, especially things like your practical OSCEs. There's a massive gap in terms of attainment and racial background, and how and when do we address that? Because it needs to be addressed. I think I went off topic, so apologies for that.
I wouldn't say off topic. I think you answered the question, but I think the question is just so broad, and racism and the impact are so multifaceted that it's easy to talk about it all. And unfortunately we can't say, but yeah, really, really good point. So thank you for that. Just going to go to the last question before we start to close. So Jess had a question, and this was when we were talking about feeling undervalued in the NHS and the implications for nurses, etc. So the question was, would you relocate as a doctor elsewhere if things didn't change? So if there was no kind of sorry, I think someone should repeat. But yeah, so would you relocate as a doctor if things weren't to change, if the government wasn't to kind of overhaul the system to make people feel more valued in terms of pay, resources, etc.? Dr. Smith, I will start with you first, if that's okay.
I think you should start with someone younger, actually, definitely.
Okay. I tried to switch it up, but yeah, that's fine. So Nana, have you thought about relocating? I know you're still kind of early in your journey, but have you thought about
Yeah, honestly, I think I would, looking at the way the NHS workers are treated. My dad actually worked here first, then we moved to Canada because of the way he was treated, the pay, resources, and everything. So yeah, I think I would, when I'm done medical school, I kind of want to look at the path of going back to Canada.
Amazing. I didn't know that. So yeah, that is a really cool fun fact. But yeah, no, thank you. That's really interesting. I know myself, I've definitely kind of considered my options. I'm a graduate student, so I've been at university for forever. So partly it is to have a break from studying, but also kind of to explore other options. So yeah, thank you. Dr. Romain? Would you really have you thought about it?
I do think the NHS is still the most incredible thing in the whole world. And if you go to other countries, like, I cannot imagine, the things that we do are incredible. When you see the state of mental health, particularly in other countries, the NHS is amazing. And so for that reason, I hope that I will always work for the NHS. The only time I've thought about relocating is when I started seeing 99% of my patients on Zoom, and I thought, why aren't I on a beach in Bali seeing people on Zoom in my hut? So that's the only reason I'd relocate, if I could do a few months in a warmer country. But no, the NHS is incredible, and I've got no plans.
Right, really, really interesting points. And yeah, thank you. I think especially from the mental health aspect, like you said, a lot of countries don't even kind of recognize mental health problems, let alone have a structure to treat people and treat people fairly. So that's a really, really good point for anybody interested in.
And one other little point I have is that I find it really odd when you go to America and you have to have like your face on a billboard, like America's #5 top psychiatrist. I would hate to do anything like that. So I'm very glad as well that our system sometimes works.
Thank you, it's a great point. Dr. Hima?
I think it's hard, given that I've got roots here, I've got family here, and they are so important for my own sort of well-being. If that really wasn't the case, I'd just jump ship. And I think that's because there's more to explore. And very interesting, look, the reason why I'd want to leave is exactly because of what Dr. Romain said. I think the NHS is a wonderful place and it's got amazing, amazing people. I am really interested in how bad psychiatry is in some countries, and I would like to go there. And I have this dream that I know is going to be quite unsustainable, but to work either in policy or disseminating healthcare with the values that we've gotten and learned, but employing those elsewhere, I'd absolutely love to do that. But before that, I've got like so many exams to do. But and I can't do them. I've just been, you know, every time I speak to my educational supervisors, like, have you prepared for your exams? But I'd jump ship, and I'd love to go to the subcontinent. And yeah.
I think that's a really good point. I think for me, when I think about kind of relocating, it's always in a short term for me. So to get an experience working in different places and use that to travel. But for me personally, I don't think it would be long term. I find being in Birmingham away from home quite a trek sometimes from my loved ones, let alone kind of being in a different country. Dr. Smith.
Well, actually, I'm nearer retirement than anything else, so you know, that it wouldn't be relocating to kind of further my career in any way. I have to, I suppose I have to very much agree with what Dr. Romain said. The NHS is a really wonderful institution, and for all the complaints that are made about it, for all the difficulties about it, for what we, you know, for all the taking for granted that happens when you're working in it, it really is one of the best health services in the whole world. And that's on every single metric, actually. If you look at the metrics, we are usually in the top 5. And I've got lots of colleagues who have relocated, you know, right from the beginning of when we started training, and also some who've relocated in post-retirement, actually. And it's usually, so for example, at the beginning, it will be for a kind of better quality of life. And you can go to places like Australia and Canada, and you will get paid more, and you will have more of a 9-to-5 job. But essentially, you'll be doing private medicine, and you'll only be providing care to a certain group of people. I've got colleagues who went and did VSO stuff, you know, voluntary services overseas, and they had a much more rewarding time. But then you know, what they learned was very specific, actually. They learned how to, you know, provide care in straitened circumstances. The difficulty with, I mean, Humma described kind of going and supporting and helping to build up, particularly around, and I'm passionate about mental health, so particularly about mental health. The difficulty with that, of course, is then, you know, in order to do that, you have to have, you know, have enough knowledge, and then you go, and the risk is that actually, frankly, you're being a bit like, you know, the kind of colonial imperialists coming and saying, we know better. It's not a straightforward thing. And I would say if what you care about is medicine and helping people to get better, then actually the NHS is the best place to be. And I really want to say to everybody, we really need good doctors. We really do. So if you can, try and stay. I get that people might think, I want to learn particular techniques, I've got to go to the Mayo Clinic and learn how to do this particular type of surgery, and actually that only enhances things. But please come back, you know. And if you're in mental health, America is about 30 years behind the UK, and unfortunately, I always used to think Canada, best place in the world to live. My next door neighbour went and moved to Canada, and I've got a friend who's just relocated to Canada. But again, Canada, surprisingly, the mental health service in Canada are about 20 years behind us. We've got really good services here. So this part of me sort of feels, I really get it. I think, you know, maybe I'll just go to Canada for a couple of years. People are always asking me to come and work in this place and that place and everything else. And I stay here because there's so much work that needs to be done here. And so, you know, yeah, well, I suppose I'm thinking, don't go, people, stay here, make it better.
No, thank you very much. I think that would answer Jessie's question. She has, while you guys have been talking, been like, yes. So yeah, really good points. Thank you. So just before we finish up, just one point from each of you to say one thing that you want us to remember or practice as we move forward. So hopefully as we move forward to being out of lockdown, but just moving forward in general. So Nana, would you like to go first?
I would say putting yourself first isn't selfish, it's necessary, because if you can't take care of yourself, how can you take care of others?
wow, that was, yes. Yeah, definitely agree. It's something that I am continually kind of practicing and reminding myself of. So yeah, really good point. Thank you. Dr. Huma?
Pandemics, disease, life and death is always just going to continue. I'd say focus on the kindness and compassion and being human through it, and leave that legacy behind, even if it's, you know, just for one person in your family or your neighbor. You don't have to think massively, but work inwards and just let that grow.
Definitely. Thank you. Dr. Romain?
Mine is basic, but not basic. So all those things that we talked about, sleep and everything like that for yourself, is not basic, it's absolutely fundamental. So
yeah, perfect. Thank you. And Dr. Smith?
So I'd say all of the above, everything that everyone's just said, absolutely crucial. And just one thing to remember as you go forward, you know, we talked about that thing before about knowing the people that you work with and giving a little bit of time to them, because if you give a little bit of time to other people, no matter where they are, they'll give that time back to you. And that will mean, if you think well of others, they will think well of you. And that does make a difference to your overall well-being. So I'd always say, it seems a very basic thing: know the people in your team, know their names, and say hello.
No, thank you. I think we think that it's basic, but it's a lot of people that actually don't do that. And I remember there was a campaign where people wore those badges that say hello, my name is, because patients had said kind of how often people will come and speak to them and they have no clue who they are. So they're basic things, but we need to remind ourselves of them, most definitely. So thank you very much, everyone, for this amazing discussion. There are some resources. Okay, I'm going to skip through these because I feel like we've spoken about most of them before, but just some kind of well-being tips to remind yourself of, and then some resources and charities who you can reach out to if you are struggling with your mental health. So one's for kind of mental health illnesses in general. Obviously speak to your GP if you are struggling, and there are services to support you. So this quick survey, if everybody besides the panel is able, or if you like to do that now, it's fine, to just take a not screenshot, use your camera to get the survey link and fill that in. And we will be sending an email out of the survey as well. So if you're not able to do that now, that's absolutely fine. So I'll just leave that for a second so everybody could get it. And yeah, so definitely kind of a big thank you to all of our amazing panel today. I personally have really enjoyed this discussion, and in the chat for people who've kind of dropped in, everybody's been saying kind of how useful and engaging and informative it has been. So thank you so much for joining us. Like I said at the beginning, this event was from African Caribbean Medical Mentors, which is the charity that I co-founded in 2017. So please keep in touch with the work that we do. Here are our socials and our website to stay in touch and kind of keep in the link. Our next event is actually next Saturday. We'll be having a Q&A session for prospective students who are interested in studying abroad for their medical or dental degree. So if you know anybody who may be interested, tell them to check out our website for more details. So yeah, a big thank you from myself and Barack Obama. And if you'd like to kind of support our work, you can, obviously we're a charity, so make a donation if you're able to. If you are a current student or doctor, join our ambassador network, volunteer, get involved in the work we do. A really key one is sharing our work. So if you know anybody that can benefit, signposting us is great, and also contributing, so supporting the work we do. But yeah, a big thank you for everybody for attending today. I was about to say, like, I have been your host, like they're doing in the like music videos or whatever. I'm not gonna do that. So yeah, thank you very much, guys. Thank you very much to our really amazing panel. Please fill out the feedback forms and message us if you've got any questions. So yeah, thank you very much, everyone. Enjoy the rest of your weekend.
Thank you for inviting me.
Thank you very much for coming.
Thank
Thank
you.
you. Bye.